The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and it must be Friday, and indeed it is. It is Friday, February 5th, and we're coming at you live from the Scottsdale Air Park Studios from Money Radio, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. If this is the first time you're tuning into the show, our show is about how our older adult population can live a healthier, happier life. How do they do that? We do that by bringing extraordinary guests here to the show. And today is a great show because I have an extraordinary guest, a gentleman I haven't seen in a few years. He's looking amazing. I am pleased to welcome to the studio Todd LaPorte. He is the CEO of HonorHealth. Welcome to the show.
Oh, Bob, it's just great to see you again, and it's great to be here with your listeners.
It's great to have you here at the show, and you are the CEO of HonorHealth. And for our listeners, because we go out on the World Wide Web, what is HonorHealth?
Wow, so HonorHealth is a lot of things these days, where I use the line, we're not just a hospital system anymore. You know, when I first joined HonorHealth 20 years ago, what was Scottsdale Healthcare at the time, we were just two little hospitals, and that was just about it. Now we have 6 hospitals across the valley through the northern hemisphere of Phoenix Metro. We have a rehab hospital. We have ambulatory surgery centers. We have urgent care centers. We have over a couple of dozen medical group practices. Oh, goodness, we just do everything. And then, not typical of a community healthcare system, we also run a food bank, have a military partnership to train critical care nurses, and we have a research institute, very vibrant.
Wow. And you know, you have the Research Institute, and we've had some guests here on the show from the Research Institute. You have all these like centers of excellence.
Yes.
I mean, Virginia Piper.
Yes.
Amazing.
Yes.
Some of the work you guys are doing.
Yeah, our cancer center, we have, I believe, the premier women's center in the valley. Really exciting development is we have created a cardiovascular center of excellence that involves structural cardiology, EP, vascular surgery, cardiac surgery. We have some unbelievable champions to those different pillars that I think uniquely we sort of bring together under one umbrella of governance and clinical sharing. So really service line excellence on a lot of fronts.
Well, you call them champions. I'll call them rock stars. I mean, seriously, you've got Dr. Isaac, who is world-renowned in some of the things that he has invented and has innovated right here in Scottsdale, Arizona.
You know, he's only one of 25 what they call master interventionalists that he is standout on a world stage. And in fact, he's currently planning the Scottsdale Interventional Forum that's bringing talent from across the globe to talk about, you know, the latest advances in their discipline. And he's hosted this for several years, and he's got that coming up. And we're improvising and doing it virtually, but by gosh, there are actually going to be live cases that are going to be shared around the world.
Well, there are other rock stars I do want to talk about, but I did pull this out. I am on the HonorHealth mailing, and you've got a big event that's coming up, and in tribute to the fact that it is February and it's Heart Health Month, and you guys are doing this symposium, if you would, around that, and it's amazing. I guess it's a Dr. Malik Shah and
Dr. Malik Shah, yes.
And Raul Doshi. Did I say their names right?
That's right, Dr. Doshi and Bob Riley. And so we have several people who are very involved with it. And like I said, it's there will be live cases, didactic learning. There will be really it's just a great networking for all these folks. And the wonderful thing is it launches usually on its first evening with a showcase to the community, so they can even engage with it.
I love it. And, certainly with the times that we're in these times with this pandemic where, we can't get together in a group, in a one-to-one setting, but we can do things virtually. And I would imagine these events and other events, you're bringing more people in because you can do it virtually.
It's funny. Dr. Reislich and I had a conversation last year about this time. What do we do? Because we saw this pandemic coming, and we just did not want to put people at risk. And so the line we used is, how do we make lemonade out of lemons? And what he did, to his credit and the group's credit, is they pivoted into now a virtual connection with the players that would normally come to this conference, if you will. And it's turned out to be something that's got more, it's got an ongoing feature to it. And so we turned lemonade out of lemons.
Well, hearts are very near and dear to me. I lost my mother to a bad heart, and I've got a father who is dealing with heart issues. But they both go to HonorHealth. My mother back in the day was Scottsdale Healthcare. So
well, and as you know, Bob, on a personal note, on Friday the 13th, June 13th of 2014, I actually had a heart attack myself.
Wow.
And it was life-changing in a positive way. In fact, I've often referred to that as, quote unquote, one of the best days of my life, because it really did allow me to appreciate my health on a different level. But most importantly, it began a journey for me to understand why it happened and just how I could influence my own health by much more proactively engaging with it. And so I've kind of been a nutrition wonk ever since, and it's been great for me.
Well, I knew you before as well as after. I've had the privilege of knowing you for close to 10 years, and I will tell you, you look incredible. Because as a result of it, you've obviously stayed healthy, you're exercising, you're probably down quite a few pounds.
Yes.
You're looking good.
Well, I'm no Tom Brady, but I do feel so much better.
Well, you look good. And, it's interesting. We're talking about rock stars, and you also mentioned the Virginia Piper Center. You've got Dr. Daniel Van Hoff, who is a rock star internationally as well.
Absolutely.
So much is really right here being incubated and created right on in the buildings and the hospitals of HonorHealth.
What he's done in pancreatic cancer and really so many fronts. And more important than anything is he really was an individual that lifted the brand of our research institute to such a stature that we've been able to magnetize other talent and trials and staff. And so just great momentum. That research institute is close to $25 million of clinical trial revenue a year now.
Wow.
Yeah.
That is just phenomenal.
Yeah.
So when we kicked off, you talked about the fact that there are 6 hospitals.
Yes.
When you started, there were just 2. And you had this strategic alliance when I sat down with you, I think in 2013, with a mature hospital system called John C. Lincoln. And, I really would love to talk to you in a little bit in the second segment about how that alliance forged into HonorHealth, because it was Scottsdale Healthcare, John C. Lincoln, and voila, we got HonorHealth. It's amazing. It really is amazing. So 6 locations, centers of excellence, military, and you also do the food bank stuff. Just fantastic. You're listening to Health Futures Taking Stock, and I'm your host, Bob Roth. I've got Todd LaPorte, the CEO of HonorHealth here. Stick around. We got a segment coming right up.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth. And if you're just tuning in, we're in our second segment, and I'm proud to have Todd LaPorte. He's the CEO of HonorHealth here in the studio. And if you missed our first segment, go up to our website at cypresshomecare.com. Click on the media button, third button down is radio show. You can catch that first segment, and you can catch about 400 other episodes we've been bringing to you since we started 8 years ago. You know, Todd, it's been a while since I've seen you. It's great to see you. You look great. You know, this is the weekend of the Super Bowl as well as the Phoenix Open. I've lived here for 26 years, and every single year I've gone to the Phoenix Open. And it's, you know, this pandemic has really impacted the sports world and the way we live in so many different ways. And speaking of sports, you mentioned that you're no Tom Brady, but Tom Brady is playing on Sunday. We got a big Super Bowl, Kansas City Chiefs, Tampa Bay. Who are you liking?
Gee, I'm going to have to go with Tampa Bay because I still feel some allegiances to Bruce Arians, who led the Cardinals.
Yes.
And I just like Tom Brady's style. I think he embodies a dedication to good health, and he is all about teamwork. To me, he is someone who puts team before self, and I like that about him.
Couldn't agree with you more. Plus, one for the old guys.
Why not?
I mean, 43. I mean, it is really...
We still got it.
It's really hard to believe that he has played. There's 55 Super Bowls. This is going to be his 10th. So when you do the math, he's played in 8% of the Super Bowls.
Yeah.
That's just phenomenal.
Yeah. Well, I'll enjoy it like everyone because I enjoy NFL, and you know, it makes for really just a nice distraction. And also what we love about sports is it's a drama where you don't know the ending until you get to the ending.
Exactly. And it's always down to the last seconds. And hopefully Sunday will be. It will be one of those great finishes.
Right.
With TB12 winning it. So when we left off in the first segment, we talked about the fact that there are 6 hospitals. When you started, there were only 2. It was actually Scottsdale Memorial at one time, then it was Scottsdale Healthcare, and now it's HonorHealth.
Right.
And you had a strategic alliance. I remember sitting across from you on your desk, and you were drawing boxes upside down, which I thought was really, really talented that you could do that. I don't know where you learned how to do it, but you were not only drawing the boxes, you were writing backwards too, upside down. But tell us a little bit about the origin. Tell us about, you know, how you guys came together. And I truly believe it's the sum of the parts that make HonorHealth who you are today.
So it's funny you should say that I was creating a visual, because those who know me know that I really can't do anything without drawing a picture. But if you can imagine, the 2 organizations, Scottsdale Healthcare and John C. Lincoln, what they both had in common was really long-standing roots in their respective communities and very community outreach minded. But what was different about them is that the Scottsdale system had a real magnetism to specialists, strong service line programs, you know, like cardiovascular, like orthopedics, et cetera. And what John C. Lincoln had that was unique was a very well-developed primary care, employed primary care community. And so when we looked at us together, how powerful it was going to be in bringing a primary care and specialty care community together, and then most importantly, working on a shared vision we both had about rallying around population health. So what is population health? And this was the notion that rather than just being a hospital system that waited passively for people to present for care episodically because of an acute care condition gone bad, instead, we would develop relationships with patients in our community before they would come to the hospital, and in a way in which we maintained relationship with them even after we discharged them from our hospital, all in the spirit of how we could shape over time, frankly, people not having to come into a hospital. And so that's the journey we've been on, and that merger of our two entities brought complementary competencies, but with this shared vision that we could accomplish what I just described.
Wow. And I'm making the assumption that it has not only met your expectations, it has exceeded your expectations.
So let me give you an example. One of the outcomes of our merger has now been the creation of an organization called Innovation Care Partners that sits inside of it all. And Innovation Care Partners is a shared governance between HonorHealth and the medical staff of HonorHealth. And together, we are, in essence, managing membership on behalf of various clients, like the federal government Medicare program, like some of the other large payers, Humana, Cigna, et cetera. So what happens is the federal program, the Medicare program, is under a program called MSSP, which stands for Medicare Shared Savings Program. So they have a baseline of what they expect the cost to be, for example, of serving that membership. And by virtue of our more proactively engaging with these Medicare beneficiaries and helping them navigate through a system, by our identifying those in that membership that are high risk and in an interventional way, interacting with them and engaging them to good health habits as well as navigation of the healthcare system, we actually, first of all, improve quality of care, improve the patient experience, but we reduce cost as a result of that. So let me give you this stat. Last year, Innovation Care Partners was responsible for about 57,000 Medicare beneficiaries. We delivered to the government a savings of $24 million on just that many people in 1 year.
Wow. I remember when you were drawing those boxes, you were telling me that through this strategic alliance and through what was happening with the Affordable Care Act and Innovation Care Partners, the ACO, Accountable
Yes.
Care Organization, you were going to be paid more money to have less people come into the hospital.
In a strange way, yes. But what's happened is yes, the hospitalizations for those people have gone down, and their emergency visits have gone down. But there are other costs in the system that have also been avoided. And interestingly enough, where we have taken the chance to say, you know what, we're going to reduce demand for our own services over here. On the other side, we have become attractive to payers and members because we have that attitude and we're improving that quality and experience. And so we're attracting more market on the other hand.
Love it. Absolutely love it. You know, I'm pleased to share with you, I don't know if you know it or not, we have been a preferred provider to Innovation Care Partners since the very beginning when it was called Scottsdale Healthcare Partners. I do want to say this, I would be remiss in not mentioning, and I know you had a real great affinity and partnership and friendship with Savas Petrides, Dr.
Yes.
Petrides.
Yes.
I got to know him on a personal level and then met him afterwards on a professional level. And what a phenomenal loss. And I know that he was one of the architects behind the ACO ICP.
Savas was a visionary. I still remember meeting him for breakfast at Chompy's over, by our Shea Hospital. And he and Dr. Gil Burrito and I talked about this vision of what I just described to you, Innovation Care Partners might do someday.
Wow.
And yes, there were drawings on napkins.
Upside down.
Of course. But this was in Savas's heart. It was a devastating, heartbreaking loss to have him pass right before the end of last year. And but we've all tried to spin it into his being inspiring us to see this all the way through.
It's a legacy.
It really is.
It really is. And I know Dr. Brito, he did my vasectomy 20 some odd years ago. and everyone knows here that listens to this show, I'm not ashamed to share my own medical stuff, but really great doctor and a great loss with Dr. Petrides.
Indeed. And our hearts go out to Terry and their children, but we miss him dearly.
Yes.
But we are inspired by him daily.
I work with Karen Vinaski, and I work with Peggy. I remember when she first joined. Yes. They're a great outfit and doing amazing work here in our community. You know, I did tell you, Todd, it goes really fast. So we're about ready to hear some music, and we're going to be up at halftime. But I do want to tee it up a little bit before we get into the second half. And I want our audience to really know who you are and your background, because when I first met you, you were not the CEO of HonorHealth. You were the CFO. So how does a CFO, who is a number guy, get into that CEO seat?
Yeah.
That in itself is, I'm sure, a great story.
Oh, well, I'll look forward to telling you about it.
Yes. Well, you're listening to Health Futures Taking Stock in You. We got a little Paul McCartney taking us out. You know, James plays some great tunes.
Way to go, James.
Yeah, we're going to set up for a great weekend. Halftime here at Health Future. Stick around. I got Todd LaPorte here in the studio. He is the CEO of HonorHealth. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it is the second half of our show right now, and I've got in the studio, I've got Todd LaPorte. He is the CEO of HonorHealth. And if you missed our first half, go up to our website at cypresshomecare.com. Click on the media button, third button down is radio show, and you'll catch that first half and many, many more. So, Todd, I want to just jump right into this because we've got so much to cover and only one half right now. So, real quickly, you were the CFO. That's the way I ended it in the second segment. That's how I got to know you. And then all of a sudden, there was a retirement of Tom Sadberry, and you were moving into that role.
So my journey is atypical in that I actually started in public accounting as a CPA with healthcare clients and non-healthcare clients. But what I think is really notable is that I served healthcare clients across the continuum, right? I had hospital clients, but I had healthcare insurer clients, I had physician group clients, continuing care retirement community, a psych hospital, on and on. And the result of that is I got a really good picture of the entire healthcare ecosystem. And so I find that comes in really handy now as I think about what we're being asked to do as HonorHealth, being more than a hospital system, but looking at how we can defragment the healthcare ecosystem, get the parts working with each other more effectively, and ultimately, almost in a team-based way, bringing better care to patients. So that was the benefit of that odd background. And then, you know, really, even though I have the financial acumen as a base, my love is really just what it is we do and strategically how to keep improving on that. And so it rolled from CFO into a chief strategy officer as well, and now into CEO.
And you've been CEO for
4 years.
4 years. Wow.
Yeah.
And you have really been put to the test since March of last year. The last time I was on a plane was March 12th, and literally we shut down as a country and a community like the next day, March 13th. And I really would like to know and really get a sense from you, what has that journey been like? Certainly It's not something that you were really expecting. And, I'd love to learn a little bit about, how that has been for HonorHealth, how it's been for you, and how are you guys doing in response to this pandemic?
So, last January, right, we were all kind of getting a little bit of the word of this novel virus coming to America. By February, we actually propped up an incident command center. Even though there wasn't a lot of activity, we propped up an incident command center that is multidisciplinary. It's bringing together subject matter experts from lots of different fields, right? It was our inspection control folks. It was physicians, nurses, med techs, pharmacists, government relations, public relations, security, IT. And what was really amazing about it is that it became this centralized place where data could come in, be interpreted, and then be used for decision-making rolling out. By March, we had some trickling of COVID hospitalizations, maybe 36 hospitalizations. By April, the government had gotten really nervous that a surge was coming, and we went into a deferred elective mode for the entire month of April. It never really materialized, but then from May through early July, this surge started to come and building up cases. So from where we were at maybe 36 in March, we grew to almost 400 cases
across the system,
which represented at that time around 1/4 of our total bed capacity.
Wow.
So we felt it. Our ICU capacity actually got taken to the brim at about 90% between COVID and non-COVID. 90% of our ICU capacity in early July, which would normally have been a slower time of the year because of the summer. So our team has been working hard all year, no break with seasonality. I will say that then late summer and then into the fall, we did see things dissipate, but then it started to pick up again. And in through the holidays and November, December, and we peaked again. We call it the second surge, was 500 cases by the second week of January.
Wow.
And that was just 3 weeks ago now. And I can tell you that today I'm pleased to say that we are now down to around 250 cases, which is almost a 50% reduction in just that 3 weeks' time.
And I know we're feeling that across the state.
Yeah.
And I know that I had a unexpected visit to the hospital in November, and the numbers were way down then. I think you only had like 50 across the entire system.
Yeah.
So we have had that peak, and certainly now it's nice to see that drop off. Variants. I mean, I know you guys were well ahead of this thing, talking about it in January. For me and our listeners, it's like, wow, I can't believe HonorHealth was preparing for this in January when, all of us were just getting that news, and you guys were getting the war room ready for what was about to happen.
Well, we have some incredible professionals in all of these different fields, but clearly our infection control team, Dr. Stephanie Jackson, Crystal Robinson, really, really on top of things. I got to tell you, though, I definitely want to use part of my time with you to really underscore to everybody to embrace the vaccine adoption if it feels right. I mean, I want to promote it. We are actually seeing signs of that our employees who've been vaccinated, that from our bubble, them having been a part of the first phase of vaccination, we are already seeing a noticeable sign of reduction of infection.
Wow.
And, if there's a couple of graphs that are in my head that we could that I would want to share, that everyone could see noticeably that since we started the vaccination process with our sort of bubble group, how it has made an impact.
I do want to talk about the vaccination process, because you guys have been right on the forefront as it relates to distribution. I saw you guys on the Today Show. I mean, that's how prominent you guys have been doing in preparing our community for this. No different than you were January of 2020, preparing the hospitals for the surge that they were going to get as it relates to this pandemic. But, the challenge that we have with vaccinations, I see, is education, because there's so much misinformation out there, Todd. And, it's interesting for me because, the surveys that come back with doctors, over 90% are getting vaccinated. Nurses, not so many.
Yeah.
Nurses, it's somewhere around 50, 60%. Direct care workers, they're the workers that do the work that our company does and so many others do, 35%.
Yeah.
And we have 20% that said, no way, they don't want to do it. But then that means we have another 45% that we could get them to sway over to get vaccinated. We just need to educate them.
Yeah. I would say that the percentages you cited are very close to what our experience has been. We have definitely seen 75+% of physicians vaccinating, of our own team around that 50%, but rising. It's a lot of factors. Some of it can be just, they're working so hard in our hospitals, just the time to take to go to our vaccine site, which is off campus. That's, some of the challenge, but we're making room for that and we're getting folks rotated in. The other thing is different things. Some it might be religious reasons. Some it might be, waiting for maybe that next vaccine and sort of let some of the early ones play out, waiting for the one-dose version. Some of it is believing, especially for young women, worried about whether or not it could create issues with pregnancy later. And even though there's no evidence to support that, but admittedly there's not evidence to support that that's not a risk, but there's really nothing suggests it should be. But the point is, there are all these different things. You're right. It's going to be education. And this really is the way we're going to mitigate the infection.
It is our version of the moonshot.
Yeah.
And we have to move fast here because this virus can stay with us way too long if we don't get ahead of it. Got a little AC/DC taking us out. Todd, it's hard to believe. 3 segments down. There's so much more I want to talk to you about. I'm going to definitely have to talk to Lauren about bringing you back. You've been listening to Health Futures Taking Stock in You. I'm your host, Bob Roth. I've got Todd LaPorte here in the studio. He's the CEO of HonorHealth. And as we break from here, I want you to know I did get my vaccination at the Deer Valley location. Your staff that was there, you had a lot of retirees, former HonorHealth people. They loved what they're doing. They were amazing. Got me in, got me out. No big deal. So
I'm so glad it was a good experience, and it will be for anyone that comes by.
Fantastic. Stick around. We got one more segment. You've been listening to Health Futures. Todd LaPorte's in the studio, HonorHealth CEO. Be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we are in our 4th segment. I've got Todd LaPorte. He is the CEO from HonorHealth here in the studio. We've covered a lot of material here. We've talked about HonorHealth in its early beginnings and where they are today. We have talked about this pandemic, and we just left off on our 3rd segment talking about vaccinations. Gosh, Todd, we've covered a lot of material, and and there's so much more I want to talk about, especially with vaccinations and these new treatments. I don't know where to go, but other than talking about the future, because healthcare is so dynamic and it is changing by the moment. And for me, for our listeners, everyone knows that I am in the home care space. My family and I own a home care agency. We've been around for 26 years. We serve older adults primarily in their home, and people want to be in their home. And this pandemic has really shown a lot of the chinks in the armor in the long-term care communities. Specifically, I love this quote by Seema Verma, who was the administrator under the last administration for the Centers of Medicare and Medicaid Services, CMS. She's made the statement, residential care will always be an essential part of the care continuum, but our goal must always be to give residents options that keep our loved ones in their own homes and communities as long as possible. Home and community-based service is not only frequently more cost-effective, but is preferred by seniors and adults with disabilities seeking to maintain their dignity of independent living. And when I think about where our future is going, we hear a lot of talk about hospitals at home. I would love to get your impression on where do you see the future, and specifically, where's HonorHealth playing in this future?
So, Bob, great observations. And I would cite the following kind of macro trends that I think were happening in healthcare before the pandemic, but frankly have been accelerated and exacerbated by virtue of the pandemic. And that is that enabled by both medical technology and digital technology, there's been a migration from inpatient to outpatient settings. And then further taking those outpatient settings to home care and remote care. And I think the pandemic has underscored why that trend has been important. People want to be able to receive certain types of care from home if they can, never really foregoing, right, that personal relationship they establish with their caregivers, but they need convenience. Some of the barriers to care in the past have been transportation or even the cost of exhausting resources in some of these other settings.
Absolutely.
So I think this is a good direction. The other big macro trend I've seen is what I call consumerism, whereas benefit designs and different programs have really incented people to become more engaged with their healthcare choices. So we look at it as we're competing for patients' attention. This is not just, they automatically come to us because we have a contract with Blue Cross Blue Shield or someone. It's they come to us because they're choosing to. So I think the overarching trends are about technology-enabled being able to perform certain services more remotely, and recognizing that consumers have choices and even more information by which to make those choices. I think the biggest challenge, I do want to make one plug today, and that is the biggest challenge in all of this is going to be attracting talent. And frankly, we've got baby boomers and a segment of our society that's going to be in that very high healthcare utilization zone that we just haven't educated and developed enough young people to be those caregivers. So I would want to say to any of your listeners out there, if you just are looking for a career to land in, please come to healthcare. We need you. It is extremely rewarding. You make an impact on people's lives that's so positive and even life-saving. That's going to be the challenge in our industry. I would like to share with you some of the things we're doing at HonorHealth. We opened a new that 6th hospital out near Anthem in Northwest Phoenix. It's called the Sonoran Crossing Medical Center. It's beautiful. We're so excited, and that whole area is developing all around.
How many beds?
It's actually can go to 70 beds, but initially we've been at close to 45 beds.
And I would imagine it's like some of the other campuses. There are physician practices that are opening up all around it.
Absolutely. We have on our sites there a medical office building, and in fact, we'll be utilizing our old emergency center that used to reside on that campus is converting into being able to accommodate that.
Nice.
So that's going really well. It opened in mid-September.
Congratulations.
On December 1st, we announced that we acquired a controlling interest in the FastMed Urgent Care Center operation. So we are going to be leveraging their subject matter expertise in that space, but making it a part of our total HonorHealth footprint.
How many locations do they have?
It's about 30 urgent care centers.
Wow.
And we add that to the 6 that we already have, so we now have 36 of these around town.
Love it.
And then, of course, we've always had our medical group practices. We kind of keep adding a little bit here and there as opportunities present. I can tell you that it'll be very noticeable if anyone drives over by our Osborne campus in downtown Scottsdale, so near Osborne and Scottsdale Road, you'll notice a 5-story building there called the Neurosciences Institute. In fact, it's the Bob Beauvais Neurosciences Institute.
Nice.
Because thanks to Bob Beauvais, one of the architects of Jiffy Lube, we received a $10.5 or $11 million gift for that institute from him.
Love it.
And that has helped some other. So all in, we have about $15 million worth of donations already towards that Neurosciences Institute.
It is amazing the stuff you're doing. And one, I want to thank you for the plug for workforce. We need more direct care workers in our space. We have a shortage in the caregiving space of 1.8 million between now and 2026. So thank you for doing that. And that whole Bob Beauvais thing, I know that you have a partnership with Barrow Neurological Institute because I know that their docs are in the Osborne location.
Yes.
I know you have many more other partnerships that we're running out of time to talk about, but Todd LaPorte, CEO of HonorHealth, and my friend, thank you for joining me today at Health Futures. Make it a great day. Have a great weekend, and go Tampa Bay, right?
Go Bucks.
Go Bucks. TB12. Bring it home. Thank you, Todd.
Thank you, Bob.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.